Thank you very much for this opportunity to present in this important conference. My name is Dr. Eugene Tuishime. I'm Assistant Program Director for Research in the Anesthesia, Critical Care, and Emergency Medicine Department at the University of Rwanda. The title of my talk is about factors leading to burnout and its impact on the quality of care delivery in health systems from sub-Saharan Africa. I don't have any conflict of interest to disclose. The outline of my talk will start with defining burnout and wellness, and then we'll see why burnout is important, and we'll then continue with major factors contributing to burnout, and we'll follow up with seeing how burnout is different in sub-Saharan Africa. We'll conclude with a summary and then a discussion points of what we will discuss after the session. Let's start with the definition. So as you may know, if you have high emotional exertion and depersonalization, you are considered to have a high risk of burnout. And on top of that, if you have low sense of personal accomplishment, then you have burnout. Why burnout is important, especially for healthcare providers? First, you have a high prevalence because you may have up to 80% of health workers suffering from burnout. And this has huge negative consequences both at personal level, professional level, and organizational level, and health system level as well. If we look on the right side of this slide, we can see that at the personal level, the healthcare worker with burnout may have broken relationships, may use alcohol and other substances that may lead to depression and suicide. At professional level, you have high level of physician turnover, a decreased productivity and professional effort, and then you have decreased patient satisfaction, leading to decreased quality of care and increased medical errors. There are many contributors to burnout, and if you address them, you may really improve the situation and lead to engagement of physicians and other healthcare providers. So those drivers include workload and job demand, control and flexibility, work-life integration, social support and the community at work, organizational culture and values, efficiency and use of resources, and meaning in the work we do. And if you improve that, you will lead to a good engagement and dedication at the workplace. And if you don't, then you may lead to burnout with exhaustion, cynicism, and inefficacy. Let's see some of good examples. So in the case of workload, for example, if you don't provide enough income, people may work more hours to compensate for low income. Or if you don't have enough staff, then people will overwork, and this may contribute to burnout. And you have also to provide some flexibility and good use of resources. And one of the examples is the ability to say no to low standard, for example, or the ability to say no to overwork. And then meaning in work. So are the talents used at the best ways possible in the organization? And it leads to the next example of fairness. So do all staff think like they get the same benefits and the challenges are shared in an equitable way? Are the staff able to provide care to everybody? And I think Rwanda is a good example on this side to provide universal health coverage with public health insurance. And then flexibility on the schedule and time for vacation. which is important as well. Another example is the way you treat health workers at the workplace with collegiality and supporting them to manage their family issues and to have a good life and a balanced life. This brings us to the next section, where we're going to see if the situation of burnout is different in sub-Saharan Africa. First, there is unique challenges in sub-Saharan Africa and other low-income countries. So as you can see, even if the population in low-income countries is about 48% of the global population, the low and middle-income countries have only 20% of the health workers. And then this is about, this is not enough. And the high-income countries have about 50 times higher the number of healthcare providers in comparison to low-income countries. And this ratio is about 10 times if you compare with low and middle-income countries. And you can see that some of the countries in Africa have less than one surgical provider per 100,000 population, which is very low. The second challenge is health financing. So if we can see the health financing in most of African countries, you can see that the health spending is less than $118 per capita. And this is very low. And if you compare to high-income countries, in 2016, the global spending on health was 8 trillion US dollars. And Africa, sub-Saharan Africa, spent only 1% of that total financing. And this is very low. And one country, the US, had 47% of that spending, and high-income countries spent 81% of that total spending. So there's a huge inequity in health spending globally. And if we continue business as usual, nothing will change in the next 27 years. The situation will still the same, and sub-Saharan Africa will have less and inadequate health spending. And this will show us how that is different, the situation of burnout in sub-Saharan Africa. As you can see, first, there is even limited data. And one of the systematic reviews showed that only 8 studies have been conducted in sub-Saharan Africa with a prevalence of 40 to 80% of healthcare providers having burnout. And this was in 2019. Another issue was lack of contextually relevant measurement tools, where the mass burnout inventory is not validated across all cultures, especially in sub-Saharan Africa. And more studies may be needed to validate appropriate tool for this context. Another issue is that factors may be the same, but they don't have the same meaning or same impact because the context is different. So most of healthcare providers in sub-Saharan Africa have inadequate equipment and supplies. They have low salary, they have high workload, they are involved with negative outcomes more often, and some countries have armed conflict. And still there's a shortage of staff, isolated rural practice, and the lack of control over working conditions, and high level of poverty in the population. We did one study in Rwanda among anesthesia providers, which showed that 25% of anesthesia providers had burnout. And actually, this was lower than the global average. more studies may be needed to see factors leading to resilience in this context. Some factors we have identified leading to burnout in the context of Rwanda include not having enough or adequate team and seeing patients with negative outcomes and also lacking enough equipment. And this was also validated with our current study, qualitative study, which showed that having a high workload, lacking resources, especially equipment and medical supplies, and having an inadequate team and a low salary and less control over work may lead to burnout. And also remote practice, where more studies may be needed to see the adequate way to support physicians working in rural places. Are incentives possible or feasible in the context of Rwanda and other sub-Saharan Africa? Those are the questions that have to be answered. So these issues of burnout have a huge impact on the health systems, with issues of staff turnover and low retention, leading to poor quality of care, with delays, errors, and low patient satisfaction. And this may lead to poor outcomes and low productivity, leading to lack of access for some patients. In summary, drivers of burnout should be addressed, especially at organizational and the system level, with consideration of local context. Addressing burnout has potential to prevent negative consequences such as staff turnover, poor quality of care faced by already fragile health systems. More research and advocacy are needed for burnout prevention and awareness among healthcare workers, especially in sub-Saharan Africa. Here are some discussion points to think about as we go in the discussion. So how is burnout syndrome different in your own health system? Who is at high risk of burnout? And what are the main factors leading to burnout in your own context? We should also ask ourselves, who is responsible in preventing burnout syndrome in your department or your unit? Also, we have to think about the meaning of awareness for yourself, for the department, for your institution. And lastly, is there a policy on burnout prevention and awareness at your institution? Those are some of discussion points. And we also continue to see the potential solutions as well as our last session of our for today. So thank you very much for your kind attention. And for further questions, you can email me at tuishimi36@gmail.com. Thank you.